Welcome to the Cornerstones Virtual Community Forum. My name is Andy Latcher, a member of the Cornerstones Board, and I will be one of the hosts for tonight's forum. The questions asked of our guests tonight were developed by Cornerstones with input by registered participants. For the forum tonight, chat is disabled for use by the audience, but may be used by the host to share info. We will be using Zoom's Q&A feature so that the audience may submit questions for our moderators to ask the panelists. The Q&A button can be found on the Zoom toolbar. We will be using the upvote feature. If there's a question submitted by someone else in the audience you would like to see asked live, simply press the thumbs up next to the question and it will move that question towards the top of the list. All questions will be captured and shared with our guests for follow-up. There is no ability to ask questions anonymously. Due to time, there will be no opportunity tonight for verbal questions, and your microphones are muted. Also, please note tonight's forum will be recorded. Before we begin, we'd like to know a little bit about the audience and your familiarity with Cornerstones by doing a quick poll. Please select all answers that are appropriate. We'll give you a few minutes to read, or seconds rather, read and answer the questions. So just pick all that are appropriate. We still have responses coming in, so I'm going to give people just a few more seconds to respond. And this helps us understand better about the people who are attending tonight. Well, what's very interesting it seems like many of you have attended programs in the past. That's great. Welcome back. And it also looks like many of you are donors to Cornerstones, and want to thank you for your support to Cornerstones. It means a lot. Well, again, thank you for also participating in tonight's forum, and it's now my pleasure to welcome Kerry Wilson, CEO of Cornerstones.
Good evening, everybody, and thank you so much, Andy, and our webinar host team for getting us organized tonight, and to everyone who's on tonight for joining us. Last year alone, Cornerstones touched the lives of 16,000 individuals and 5,000 children. In the last 3 months alone, more than 6,000 families have reached out to us for the life-changing assistance that we've been able to provide with your help. When I think about those statistics, they really mask the fact that the issues Cornerstones has worked on every day for 50 years, these are very personal. It's what we're feeling now. When you don't know where you're going to sleep, or as a parent, when you can't feed your children, when you are afraid to go out because of very real health concerns. The pandemic has just brought that reality home for us all. The fear of getting sick, months in isolation that have increased stress in the home for each one of us personally, and I think most of all, not knowing when this will end. We've seen as well that just as poverty and the issues that we're confronting in the Commonwealth today, that the virus has shown a disproportionate impact on people of color, immigrants, people who don't have the best access to healthcare, those who lost jobs in service industry, or those who are still reporting to work and don't have protections on the job. As we head into the next few months and sort of what's happening, it's important to us, and it's why we're so delighted that our panelists tonight could join us to really talk about how the Commonwealth has worked so far to bring us the resources and to identify the challenges, but also where we're headed. And we're really interested in talking with them about that. As Andy mentioned, we had asked for people to send in your questions, and I'm so glad that your interests, as shared in the online survey, really align with the things that Cornerstones is seeing here today, and particularly related to the COVID. The impact of job loss and unemployment, what is facing people now that unemployment benefits are running out and we're not back to work. The governor's recent action to stay the eviction moratoriums for another through September. There are 6,000 eviction cases on Virginia dockets today, and those are families here that we may not have the resources to help with that without additional support. Everything that I think our panelists were working on before COVID hit, real resources for affordable housing. We've been seeing those resources probably disappear, but those are the things we need now. Cornerstones in particular has seen the impact of what is happening with children and families. Like everyone, we've had to reinvent our programs to provide that support, and we're seeing the real impact of the digital divide. Are kids going to be ready? Are they going to have the support they need as our schools have to continue to work virtually? All of these things are things that we are so proud to have been able to work on with each of you, and the issues that we're going to talk about tonight. And I think they characterize the work that you all know, everything we do and what is needed in our Commonwealth today, which are stability, empowerment, and hope. That's what we need to bring home to people here in your districts. So as your trusted advisor, we look so forward to continuing to work with everybody here and to hopefully hear from our panelists tonight what we can do to help them take issues back to Richmond. So we are so grateful again for attending, for all of you to coming here tonight. You'll meet our panelists in a minute. But I would like to welcome our moderators for this evening who've put a lot of time into sorting out the questions. Two women who are leaders of our organization, Tracy White, who is the chair of Cornerstone's Advocacy Committee and is on our Cornerstone's Board of Directors, as well as Cheryl Simpkins, who is the vice chair of Cornerstone's Housing Corporation that provides over 100 homes for people in need in our community. Thank you all, and I'll turn it over to our moderators.
Thank you, Carrie. It's a great pleasure to serve on Cornerstone's Advocacy Committee, and I'm honored to help moderate tonight's community forum along with my colleague, Cheryl Simpkins. Let's start tonight's conversation with an introduction of our distinguished state officials. So please join me in welcoming Senator Janet Howell, representing the 32nd District. That district goes from Reston east to Tyson's Corner and Falls Church. Welcome, Senator Howell. Also, Delegate Ken Plum from the 36th District. Ken represents the Reston area. Welcome, Ken. Senator Jennifer Boysko, representing the 33rd District. That area is from Herndon west to Sterling and Leesburg. Welcome, Jennifer. And Delegate Ibrahim Samira, representing the 86th District. Ibrahim represents Herndon and south to Chantilly. Thank you all for participating with us tonight. Senator Howell, we're going to start with you for our first question. As chair of the Senate Finance Committee, you're preparing for a special session that's going to start next week. Can you tell us a little bit about what you expect, what you think the priorities of the session are going to be, and what issues are you planning on following most closely?
Thanks, Tracy. It's great to be with you. I always love being in contact with Cornerstones. I've been in the Senate 30 years, but for 10 years before that, I was on the Cornerstones board. So I take such pride in all of the good works that's going on here in the Reston Herndon area and really appreciate it. We all know we're in terrible times, totally unprecedented times. and the funding is very, very limited for the most pressing needs that we have. When we left the General Assembly in February, we had a budget I was so proud of. We were making up for lost time and investing in our people, in human services as well as in education at every level. And then in the 6 weeks before we got back to the veto session, everything collapsed. And we were suddenly faced with a more than $2 billion shortfall. Think about that, $2 billion. So what the governor did was something that was unprecedented, and none of us even knew what the word meant. He unallotted funding. And what that means is it's still in the budget, we just can't spend it. So we are now have over 100 major initiatives that have been unallotted, and we're trying to figure out which we can bring back to the fore. And sadly, the outlook isn't much better at this point. We are still expecting more than $2 billion in a shortfall. Our budget will be austere at best. The only thing I take solace in is that there are some states even worse off than we are. They are going into their base budget, which we have not had to do at this point. The big unknown for us is, of course, federal funding. We are dependent on having something pass, not only to help, Virginians who are unemployed, but to buck up some of our most pressing needs. When we go into session next week, we'll find out what the real forecast is going to be from the governor, but I can tell you it's going to be bad. We're going to remain austere and really pressed. And I hate being this downtrodden about it all because I'm basically an optimistic person. But we are going to be facing extremely hard choices. If at all possible, we can redirect funding. I have two major priorities. One is mental health, and I'm glad that's one that you have highlighted as well. And the other is education at every level, from the 4-year-old initiative through public ed, higher ed, and community college job training. I think we need to be looking toward the future to the extent we can.
Thank you very much, Senator Howell. I'm going to throw it over to Cheryl, who's going to ask the next question.
Hi, Delicate Plum, this question is for you. Working parents are struggling and they need help with childcare so they can get back to work. Students in our local school districts will be going to school online this fall rather than in person. Childcare centers and programs will be finding ways to provide all-day care with safe learning spaces for school-age children of working parents. So there's no guaranteed funding for this, but what can the General Assembly do to help fund these programs?
Well, Cheryl, thank you for that question, and thanks also to Cornerstones, all your staff and volunteers who provide such essential services in times like this. We have learned the harsh lesson once again that the government doesn't have all the answers, that in fact we're dependent upon faith-based organizations and nonprofits in the community, and thank you for the critical work that you do. The General Assembly session of 2020 was the most transformative and the most progressive that I have ever experienced in my length of service there. Among the things that we gave priority to related to what the question was you just asked, childcare. We had a major reorganization of childcare that I believe will result in us more efficiently and effectively offering childcare support to community-based organizations, public sector, and other folks who are in the business of offering childcare. And we also included in a progressive, again, the most progressive budget I've ever been part of passing, money for helping up with childcare. As Senator Howell has just so well stated, and we hate to be the deliverer of bad news, but everyone knows what has happened to the economy during this pandemic. The resources that we had planned on in March, by April, were gone. And as a result, the governor will this Tuesday give us his best recommendations as to what we might be able to do going forward. It's going to be the case that we're not going to be able to do as well as we had hoped for with the budget that we passed in March. But we will recognize, and recent commentary has talked about, when you talk about the restoring the economy in this period of time, one of the key factors of restoring the economy is childcare. Folks being able to go back to work and so on is a critical one. As a former educator and school administrator, I have felt a lot of pain as I have thought about school administrators and others who are planning for an opening that is unclear as to how it can be safely accomplished. We need to recognize that we need to get the economy back on its feet, but at the same time, we need also to make sure that our children and our community leaders and others are safe, community leaders being teachers are safe. So come Tuesday, tune in to listen to what it is the governor has to say in terms of how much he's being able to prioritize childcare. I know Mrs. Northam is talking in his ear about do a good job for childcare because that's been her top priority. And while we're well-intentioned as we go forward, I will tell you right now, it's a little bit of a cloudy picture.
Thank you, Delegate Plum. Appreciate that. Tracy, back over to you, please.
Senator Boysko, this question is for you. It's regarding unemployment. With job loss increasing and many people are struggling to pay their bills, enhanced unemployment benefits expired at the end of July, and of course we're still waiting for Congress to act, and a minimum wage increase in Virginia is coming, but won't help the workers who are out of work now. What can the General Assembly do to support those who have lost their jobs?
Yeah, thank you, Tracy, for the question. And I mean, this is something that is hitting so many people. Daily, I receive letters from constituents who are struggling. Yesterday, I got one from a man who has been working on trying to get his benefits since March. And his comment was, running out of money, the rent's due, I'm a single dad of 3 kids, I'm at my wit's end. And that's something that I'm hearing day after day after day from hundreds and hundreds of people who live right here in our community. And it's a real crisis. I'm serving on the Unemployment Commission. We know that not only are we spending the funds that we've had, but if we don't get help from the federal government, we're going to end up having to put a burden on our businesses to shore up the unemployment fund, which is certainly not something that we want to do at a time like this. So we are really calling on our federal partners in Congress to work out a system so that we can, one, continue the unemployment funds, including the $600 per month, but also to shore up at the state, for the state's unemployment insurance program so that we're not in the hole. Virginia has to balance its budget every single year, so we don't have the ability to go into a deficit. The thing that I've spent all of my time doing and my staff is working with our VEC person by person to try to advocate for our constituents, to make sure that they've got the proper information on each of our folks who might have made some small errors, and to really just prod to say, do not forget about this person. This woman has $12 left to her name. We gotta get this money through. And so it's really in the casework that I think we've really all been advocating for our constituents. I'm looking forward to seeing what the budget's going to have to say about any additional assistance that we have. As you heard from Senator Howell, the news is not optimistic. And so, again, I'm thankful for the groups like Cornerstones. One of the things that we do when we talk to a constituent who's having a really difficult time is we give them the information for the county services, and working in collaboration with the Fairfax County Board of Supervisors like John Faust and Walter Alcorn. we're trying to help make sure that they know what resources are available, going to a food pantry, having, other kinds of assistance. But this is the most difficult time I've ever seen. And we're certainly taking it very seriously and understand that this is people's lives.
Thank you, Senator Boysko. Cheryl, to you for the next question.
Delegate Samira, you are an advocate for better access to affordable housing and have argued that this is a racial equality issue, a racial equity issue, I'm sorry. So can you share your thoughts on this topic and tell us how you are working with your General Assembly colleagues to address it, please?
Sure. Thank you so much for having me. First off, huge shout out to Cornerstones for the amazing work that they do in our part of Fairfax County. Herndon is absolutely tremendously grateful for the hard work that Cornerstone does. Affordable housing is a critical issue that is often ignored. The economic consensus is clear that where you live, down to the exact neighborhood and block, often determines your social and economic outcomes. That's because housing not only decides your health and stability, but your physical access to good jobs, quality schools, healthy food options, public transit, and other crucial services. It's for this reason that racial and economic segregation presents generational disadvantages to communities across Virginia. In Virginia and across the country, really, there is a growing shortage of affordable, available homes. Northern Virginia is hit particularly hard by this shortage. Continued economic and job growth is not being met with new affordable housing construction, especially in the desirable neighborhoods that need it the most. A key culprit of this lack of new affordable housing is exclusionary zoning that acts as a ban on higher density housing types. Exclusionary zoning practices, particularly a lot of our beautiful single family zoning, make it extremely hard to create new multifamily missing middle homes, which are proven to be less expensive, better for the environment, and more accessible to marginalized communities. Instead, new housing development is relegated to the far suburbs, pushing low-income people farther away from job centers, increasing car and highway dependency, and damaging Virginia's natural environment. Plus, the scarcity of housing units in those job centers translates to ever-rising rents for existing residents. I was the first elected official in Virginia's legislative history to propose statewide zoning reform. In the 2020 legislative session, I introduced HB 151 and HB 152, which would have legalized the development of two-family housing types like duplexes, townhouses, and accessory dwelling units, which is also familiarly known in Virginia as granny flats across the Commonwealth. That was the purpose of those two legislations. This would have allowed the housing market to create more of this middle housing that's missing because of the zoning rules that are standing as undue barriers. It would also make local governments appropriately think twice before zoning out new, sprawling, very low density suburban development, and instead lean on the benefits of good middle housing density. This isn't skyscrapers. This isn't huge apartment buildings. We're talking about duplexes here, and we were trying to promote density here for affordability by increasing the supply of housing units and for the environment, to combat the legacy of neighborhood segregation, to facilitate better public transit and make for a more connected local and regional economy.
Thank you. Thank you so much for that, Delegate Samara. Tracy, your next question, please.
Our next question goes to Senator Howell, and it's regarding mental health. So as you spoke about, you've been part of a long multi-year effort to provide better investments in mental health. This session, budget dollars were again set aside to continue those investments. And of course, we need that support now more than ever, especially due to the way COVID-19 is exacerbating mental health issues of job loss and isolation, substance abuse across the Commonwealth. Knowing the challenges that are in front of you, what can be done to ensure coming out of this next budget cycle and through it that these investments can continue going into mental health?
The General Assembly about 5 years ago had a terrible tragedy hit one of our members when Senator Creedy's son was turned away from any assistance for his mental health crisis because there was literally no room at the inn, and ended up killing himself and severely injuring his father, our friend Senator Deeds. At that point, we put together what I call the Deeds Commission. It has a more official name. But for more than 4 years, we've been meeting and making, I think, significant progress in how Virginia not only funds mental health, but how we view it. And we've put together something called STEP Virginia to reform our whole system statewide. Now, we need to understand that here in Northern Virginia, our system is really very good. But in other parts of the state, there are huge desert areas where there is virtually nothing available. So we have been working on this for, as I say, about 4 years. And in the budget, we had put $154 million of additional funding to move us forward in these reforms. Those also have been unallotted. They're in the budget, but there's no funding and nothing can be spent for them. So it is a major priority for all of us to really go forward on our mental health improvements. Virginia, I have always viewed Virginia as being disgraceful in most areas of the state when it comes to mental health. So it's a huge, huge priority. I did want to, something I had meant to say on the last question and didn't, because people are proudly saying, well, why don't you just spend the money? The problem is in Virginia, our Constitution says we must have a balanced budget. We cannot go into deficit. And that is why we are having to make cuts everywhere and are so dependent on the federal government.
Thank you, Senator Howell. Cheryl, back to you.
Okay, Delegate Plum, my question is for you. As a member of Public Safety Committee, you will have an opportunity to review, vote on the policing initiatives that's being introduced. Our communities are safest and strongest when there is trust and established relationships between police officers and the community members that they serve. So Cornerstone supports efforts such as Fairfax County's Diversion First initiative to offer alternatives to incarceration for people struggling with mental illness, substance abuse disorders, and or developmental disabilities. How will the Public Safety Committee work during the special session to ensure that trust is being built between our communities and our police departments?
Cheryl, a real critical question. While we recognize that we are in a pandemic related to COVID, we are also in a social revolution with the fact that we now recognize how much inequality there has been within our community. The pandemic pointed that up, but also too the action of police in some communities pointed it up. And so coming to a head at the same time as we deal with a pandemic, as we deal with needed changes in our budget, we deal with the fact that we need also to take a look at our criminal justice system. This is not a new problem. It's been around. And it's one that we have kind of set aside, but now we are at the point of where decisions have to be made. I'm pleased that the House of Delegates established a Public Safety Committee this past legislative session on which I serve. And you may know that from that legislative session, we passed 7 very significant gun control measures to try to make our community safe with reasonable gun control laws on the books. We expect to continue that work this legislative session. Over the past 2 weeks, the Public Safety Committee, along with the Committee on Courts of Justice, has had 3 Zoom kind of meetings of public hearings with expert witnesses talking about the problems that we have in policing, the problems we have in criminal justice, and what might be introduced by way of proposals to deal with those in this special session. Today, the Speaker of the House announced 15 different proposals that we're going to consider. There won't be any surprises on the list for people to know that we're going to work for improving the standards of accreditation for police enforcement offices and so on, the training of our police officers. The notion about defunding our police is one that I know some people use that phrase to try to dramatize the issue. But in Virginia, defunding is not the issue. Funding is the issue, making sure that we can attract the best and the brightest to our public law enforcement, that we can give them appropriate training, and that we can also redefine a bit about what police are about. Senator Howe talked about the program that we have underway here and locally with the police in terms of diversion of people who have a mental health crisis. That needs to be done statewide for police to understand the kind of behavior that might be the result of an autistic person, somebody who is having a mental health episode, is something that we need to train them for, and we need to put in place the diversion of them. But you can expect that the redefinition, the reimagining, if you will, of law enforcement is going to be front and center. When you look at the special session on Tuesday, it's about the budget, it's about responding to COVID-19, but it's also about equity within our law enforcement.
Thank you. Thank you, Delegate Plum. Tracy, you have another question for Senator Boysko?
Yes, thank you. Senator Boysko, with the eviction moratoriums that are going to expire and more families are at risk for becoming homeless, many immigrant families in your district have been those who have been hit hardest by COVID-19, and they're unable to access the resources and support that they need. How can Virginia use CARES Act funding and state actions to help these families and prevent them from being evicted from their homes and to get the resources that they need during this time?
Sure. Thank you, Tracy, for that question. You know, I've worked really closely with our immigrant community over the past 5 years as a legislator, and for the past 15 or 20 years as a community activist advocating for civil rights and the needs of our wonderfully diverse community. And you're well aware, probably, I don't know if everybody on the meeting is aware, that Fairfax County got $200 million in CARES funding. A lot of that money went to nonprofits who are here in our area to assist with these kinds of things. I have had a number of conversations with the governor's staff to make sure that our immigrant community does not get left behind. And he has been very outspoken about making sure that resources are going into our communities with high immigrant populations here, as well as in other parts of the state where we've seen some flare-ups in those populations. We will continue to monitor that and to think of out-of-the-box solutions. One of the things that I want to mention is I'm the chair of the Broadband Advisory Council. And when we talk about inequity, we know that there are plenty of families right here in our community who, while we have access to the internet, can't afford them. And many of our communications companies are offering discounts so that it's like $5 to $10 a month. Some families still can't even meet that charge. And so this Friday, we're going to be having a meeting to talk about what else we can do working in collaboration, whether or not we can get CARES funding to help bridge that gap as well, but also what folks can do. This is really an all hands on deck problem with eviction and with just making it day to day. And it's with the great help of groups like Cornerstones and our other community partners that we're in better shape than we would be had we not had you all at the table with us. So as we continue to have good communication and understand where the challenges are, we can again navigate some of those systems. But I'm just so glad to have you all as a partner through all of this.
Thank you, Senator Boysko. Cheryl, back to you.
Delegate Samira, this question is for you. So many people throughout the Commonwealth have lost their jobs And as a result, they've lost their health insurance. So what is the General Assembly doing to be sure we all have access to the health care and the medication that we need to stay healthy?
Sure, very important question for me, Cheryl. I'm a healthcare provider, for those that don't know, and a really topic close to my heart as well. We are working on issues within the reallotment category of the budget. Senator Howe was saying a lot of money hopefully will be returned for healthcare services, specifically services that we can receive federal dollars for it and matching. Those are, free dollars that we could be taking if we put state dollars in. So I think those are hopefully going to be covered in Senate Finance and beyond as well in the House. But more broadly speaking, millions of Virginians cannot afford to be healthy. And we must begin to reverse this reality, this corrupted reality, through the passage of a public option into law and making Medicaid or Medicare for all who want it faded. In the 2020 regular legislative session, I was proud to be the only legislator that put forward a plan to provide affordable universal health care coverage for all in the Commonwealth. As the price of prescription drugs like insulin skyrocket nationwide, those who don't have the money to afford it are forced to simply face their illness without pharmaceuticals. That is wrong. I co-sponsored legislation that caps insulin copays, as well as all my colleagues on this line, to be at extremely affordable rates in Virginia. The insulin cap overwhelmingly passed the legislature at $50 a month. I also helped lead the effort to crack down on pharmacy benefit managers. Those are popularly known as the middlemen in the pharmaceutical industry, and their hurt of patients in pharmacies through bad business practices. Nonetheless, the problem of millions of Virginians not being able to afford to be healthy continues. It's no secret that extremely high healthcare costs are hurting all of Virginia's working families' public health, especially those on the margins. These disadvantaged Virginians that are dying due to COVID-19 are disproportionately coming from financially poorer backgrounds, but also are disproportionately Black and brown. The disproportionality of COVID-19 that are statistically very similar to this proportionality that exists in the statistics on those that cannot afford to be healthy. That is just unacceptable for us here, Herndon, Reston, Sterling, Chantilly, but also all of Virginia, especially when Virginians are skipping out on treatment in the midst of a national coronavirus pandemic due to justifiable fears of the cost of treatment that may not be covered under the CARES Act. Because of the poor healthcare protections that our most vulnerable Virginians have, a public option must be offered to all Virginians that may need it as part of a comprehensive treatment plan to protect them. I will give 2 quick reasons why a public option is absolutely necessary. First, a public option would provide truly affordable insurance coverage for any Virginian. And second, a public option would offer cost-saving plans without the need to raise a single penny in taxes.
Thank you, Delegate Samara. Thank you so much. Tracy?
Thank you. Well, we're going to shift now to some of the questions and answers that our participants have been putting into the Q&A box. And we've got a great one that's risen to the top that I think I'll do a speed round with you all. So I'm going to start with you, Janet. We'll go in the same order. And the question is, what are the top 3 things that you would like to see citizens do to support each other in our communities right now? So just 3 quick things that you think people could do, and then we'll move on to Delegate Plum and Senator Boysko and Delegate Samira.
What a great question. I think that, first of all, we need to be really listening to each other and understanding the challenges people are facing, and try on an individual basis to make it better for them. I also think that we need to be putting political pressure up and down at every level to make sure that elected officials are recognizing how serious these things are and doing something about them. And thirdly, I guess just be kind to each other, because right now is a really tough time.
Thank you. Ken, your 3 things.
Yeah, a good question. We are all in this together, and recognizing that one of the real deficiencies in our wealthy community of Reston and Northern Virginia, relates to food. So get to know who the food banks are. Cornerstones has a great one. Women Giving Back, South Lakes High School Pantry. A lot of different organizations are collecting food. Make sure that you each week contribute at least as much to the food bank as you consume in your family. That's a good measure to start off. Number two, recognize that the politics of the world in which we live now will affect how a lot of these things are dealt with. So be sure it is the case that you and your neighbors and so on are registered to vote, and recognize also too that voting could be a little tricky come November if we're still in a quarantine kind of mode. So look at how it is that absentee ballots are available, and that you can vote by mail using an absentee ballot without having to have an excuse for being absent. You can simply do it that way. And number three, I would echo the third point that Senator Howell mentioned. We're all in this together. We really need to be helpful and supportive of each other and be kind and look out for each other.
Thank you, Senator Boysko. And it's okay to repeat. If you really, think that that's something great, please feel free to say ditto.
Sure. So I agree with everything that my colleagues have said. I'm going to add on to wear a mask, to practice social distancing, to wash your hands, because just like your doctor does when you have surgery, wear a mask to protect you, we need to be doing that for one another. Also, I think getting off of social media and taking a break from all of the vitriol that we see, the back and forth, and use that time for some self-care. I take a walk every day and get it out of my head because I really need it. So taking care of yourself, and then taking care of the people around you, checking in on your neighbors who might be elderly and really not had anyone to talk to in days. Just realizing that the way you care for others really matters this time now more than ever. And again, voting and, checking in with your nonprofits to make sure that you could help them also.
Thank you. Delegate Samira.
Wow, so much pressure on these three recommendations for folks. I support everything that all my other colleagues have said, and really appreciate them bringing it up. I also would add that I think we're in a moment of racial reckoning across the country, and I think a lot of us are thinking about our place in society and how we can use our privilege to the advantage of those that need it the most. And it requires a lot of education. And I think picking up some pretty good books on anti-racism in practice would go a long way. I touched a little bit about housing. There's a really phenomenal book out there, The Color of Law. It actually talks a lot about Virginia and the legacy of segregation in Virginia. And so we can understand a little better how it is that we can desegregate our systems. There are things that we might be participants in that we don't know anything about, and we are not supposed to be personally to blame, but we do have the capacity to learn, to educate ourselves. That's at a higher level than other places, other communities in Virginia, because of our distinguished education systems that we have here that we were brought up with and beyond. And so that's one thing. Another thing is really thinking about how you can also show up to the General Assembly. I mean, nowadays, take a little twist out of my 28-year-old book over here. You can probably get on a committee and testify on an issue of choice that you care about deeply by just signing up on a Zoom link. So that's a very different reality than I think just last session, well, just a few months ago, where you had to probably book a hotel for the night and then show up the next morning really early on and line up for hours and maybe not even get a chance because there's so many people that want to speak on the issue. It might be the case as well now, but it's really important for you to participate in your particular way in supporting us, your legislators, in the efforts that we push, the things that we're working on for you by showing up for us at the General Assembly. And third, I think is the most important thing to remember is that, you need to take care of yourself, your mind, body, and soul. Whatever it is that you need to do it, because your privilege mixed in with your health will mixed in with your anti-racist work will actually advance our society. And all politics is local, and that's not cliche.
Thank you, Delegate Samira. Those are all great points, everybody. Thank you very much. Cheryl, to you for the next question.
Yes, the next question how will you partner with local faith communities to advocate for more affordable housing and resources for our homeless neighbors? And whoever would like to start first, be my guest.
Well, let me start by commending Cornerstones not only for the great work you do in the community, but for the great work you do in the legislature, keeping us informed of community needs. We simply cannot deal with the range of issues that we've been talking about tonight without a partnership with the nonprofit communities. I mentioned just a few of the food banks, but there are many more food banks that are out there, as well as groups that relate to housing and so on. Our affordable housing effort has, for the most part, come out of the nonprofit community. So be aware of the fact that we need you. And so do become involved and know that we're open to and welcoming of your participation.
Thank you.
I would like to add, I saw that Stephen Smith Cobbs was the person who asked this question, and he's someone who is in the community doing great stuff and really uses his faith in his life, right? Walks the walk. I'm the daughter of an Episcopal priest and grew up with the same, attitude of you live your faith by the service that you do for others. And so we have worked for years in the community with the different faith groups. I'm very active with the Adams Center, where they are forever going out into the community and helping those who are less fortunate, as well as groups like Voice, which is a large group of faith leaders from all around. They're moving out into all of Virginia now, advocating, not only doing good work in the community, but also advocating for the issues around people who are disenfranchised and need someone to stand up for them, people who don't normally have a voice. And so I think the pairing of actually doing the work with the community, but by helping amplify what's going on, whether it's using social media to say, hey, check out this food drive or this effort, or participating in it, or bringing them in to collaborate as we are looking at public policy and making sure that we're listening and getting the best information, as Delegate Plum said, making sure that we're being partners. It's so important.
Thank you.
Yes.
Go ahead, Janet.
Senator Howard, go ahead.
I'm going to say, for years, I was very concerned because actually, statewide at least, most religious organizations were silent. They just didn't play a role at all in the General Assembly. There was a Virginia Interfaith Center that did way back when, but that was about it. And I am really excited about how activated so many religious organizations are. Voice was mentioned. That is a huge pressure on legislators. And I think it's making a difference. And it's bringing certain issues that we might not have focused on at all to the forefront. And it's very useful.
So, thank you. Delegate Samira, would you like to add anything?
Absolutely. Thank you, Stephen, and wonderful to see you here, and grateful for all your work with Voice and our community at large here in Herndon. I would add that, I've been seeing some ways that actually make sense for faith communities to use land that they may not be using as much because of, for different reasons that faith communities have. Maybe they want to use it in the future, et cetera. But one particular use that I've been seeing is the usage of that land to build affordable housing that returns profit for the community of that faith. So in a way, serving our affordable housing needs, but it's also to revitalize that community, that faith community that you're a part of. And I think it's a unique approach to utilizing one's resources, especially with a lot of our congregations having a lot of unused land. And I think that might be something maybe we can talk about offline, but something of an interesting idea that I've heard a lot happen in other parts of the country with regards to using churches that have lost a lot of their attendees, for example. And so there's something to that approach of a win-win, hopefully, for faith communities.
Thank you. Oh, great. Tracy?
Thank you very much. All right. Well, we have another question from the audience that I think is very interesting, which is, since the 2020 session adjourned and COVID-19 hit and changed everything, the demands for racial equity remind us that there is still much work to be done. How can the General Assembly reevaluate its work and its priorities, not only during the general session, but into the future sessions, about ways that you can look through the equity lens and assist us moving forward? And if anybody would like to jump in and start.
I mean, I'll start. I'm a member of the Judiciary Committee and the Rehab and Social Services Committees. And I'm serving on the ad hoc committee of the Senate to look at our criminal justice reform. And we are absolutely looking holistically at what we need to do. Last year, we started a bunch of the work to try to right the wrongs in our public policy. We are continuing. We have a suite of really 6 or 7 categories, from police brutality to sentencing to the way our courts are structured to our prison reform that we need to do. But you're right, we need to look holistically at everything. And so I have for a long time championed things like paid family and medical leave, because we know that it is the people who have the lower paying jobs who don't have that flexibility when something serious happens in their family. Working on equal pay for equal work. Again, Black and brown women are most disproportionately affected by unequal pay in Virginia. Access to education. I was the sponsor of the DREAM Act here in Virginia, which we finally got passed after decades, and then also expanding who can have a driver's license in Virginia. After 9/11, they restricted and said you had to be a citizen, with very tiny exceptions in Virginia, to having access to a credential. We changed that this past year. We are having a more and more diverse community, both socioeconomically as well as culturally and racially. And we know that especially our Black and brown brothers and sisters have been disenfranchised. Again, we haven't even talked about this, but our LGBTQ community finally, for the first time, we are the first state in the southern part of the nation who has now put protections so that people are not going to be able to be disenfranchised. We are committed to this and excited about the progress that we made this past year. There's a lot more to do, and you better believe that all of us on this call have that lens that looks at how is everyone affected, not just how am I affected, right? Like, our job is to represent everyone. And again, the 33rd Senate District is a beautifully diverse community with people from all over the world, all different socioeconomic backgrounds. And it's important that everyone has a voice. And that's something that I really treasure.
Thank you. Anybody else?
Well, we have a wonderful record to build on in terms of what happened in the 2020 legislative session. We passed the Virginia Values Act, for instance, that eliminated discrimination based on sexual orientation, race, and so on. We expanded our hate crimes bill. We have a solid foundation from that session. But beyond that, we now have, as I say, at least 15 proposals that I'm aware of that all focus around criminal justice system, and that is to deal with the racial inequities that exist within our criminal justice system. It is really shameful to listen to the testimony that we've had over the past couple of weeks with the Public Safety Committee to realize just how discriminatory our law enforcement and our criminal justice system has been. To talk about, for example, a pipeline from the classroom to the correctional system is really quite shameful. So I feel confident that based on the work that we got underway in January, February this year, that we're going to continue next week and that we'll continue through the 2021 session. And I share the enthusiasm with all the things that we could say about how tough times are. The enthusiasm that I see and feel among people who recognize that racial equity is an issue that has to be dealt with and that we're going to deal with and go forward.
Thank you. Delegate Samira, you're on mute. Delegate Samira? Okay, well, we'll hope we get him back here quickly. Senator Howell, did you want to say anything?
Well, I agree with everything my colleagues have said. The thing that is exciting to me is that this is now top priority. It's been kind of an issue that we were all aware of, but now it is right at the top of everybody's agenda. We had passed in the Senate a number of bills that got sent to the House and then were being studied. And now I think they're really going to make it, and it'll help.
Great, thank you. Well, we hope that we get Delegate Samira back, and when we get him back, we can offer him the opportunity to speak to that question as well. But for now, I'll roll it over to Cheryl so she can put the next question in to you all. Thank you.
The next question that I'd like to present from the audience is, what are your suggestions for how small businesses can support our local economic recovery?
Well, Cheryl, if I could start off, I might say that we need to turn the question around a little bit and say, what can we do to support our small businesses? Because the fact of the matter is small businesses are hurting, and small businesses are the backbone of our local economy. So make the decision not simply to go online and order everything for delivery. Make the decision to buy from your local vendors, your local stores, your local shops. That helps keep them in business. We expect to see more money coming from the federal government to help shore up local business, but let's be patrons of local business to help keep them afloat.
Thank you. Anyone else?
I would just say, help amplify what's going on, what the opportunities are. I know the town of Herndon has done a great thing where they have signs out to say, we can deliver food or whatever. My husband and I are making an effort and have through this entire thing to at least order out twice a week, if not more than that, so that we're supporting our local restaurants. So I agree with what Delegate Plum said, was we need to be thinking of ways of helping our small businesses because they are the backbone of our economy, and we know that they're struggling terribly right now. So.
Yes.
Hey, y'all, I got muted. I'm so sorry. And then I didn't know what happened.
It's okay. Welcome back.
Thank you.
The question that is on the table right now that came from the audience was, what do you think we could do how could we support our local small businesses? But as Delegate Plum pointed out, it's a very good point. What can we do to help them? Because they're the ones who are really going to be struggling to maintain their businesses. So anything you'd like to add, please go right ahead.
Gosh, I've had my team begin to call every single small business in my district all across it, and it's an arduous task. But we just ask, you guys have any trouble getting PPE? Do you have any trouble getting the PPE as well? The two similar acronyms. PPP, of course, is the protection program for employees of small businesses. It's not a state-funded program at all. It's a federal program, but we figured out how to help people, and so we've been asking them, specifically businesses of people of color, because they've been actually not applying as highly as white-owned businesses in the United States overall. So that's something that I think when you guys were talking about the last question, is how do you reprioritize equity, and it touches a little bit upon that from a business perspective, a small business perspective, to be specific. But also to go a little beyond that, I do want to touch upon that question, because I started talking and you guys couldn't hear me. But what is really important with that, and sorry to go back to it, but it's so important to me, is to think about, what do people spend their money on every single day? Specifically, what do people on the margins spend their money on every single day? And thinking through that as a category. We know that, for example, people of color in Northern Virginia spend about 30% of their money on rent or mortgage. That's disproportionately higher than white families in Northern Virginia, for example. What about healthcare spending? Also, same thing, disproportionately higher spending of their income on healthcare. So we need to think about what it is that causes these issues to develop in people's spending habits, because at the end of the day, equity, a lot of it's about money. A lot of it's about generational wealth. Can you keep your money in your pocket so that you can provide it for your children to come and your grandchildren? And furthermore, it's generational wealth that we need to be cognizant of, that everybody else, not just those that are privileged in our society, deserve. And so thinking about that paycheck portion of how that money is spent, and then thinking about the systems that cause that higher expenditure, the disproportionate spending to happen, is vital. And so that means that we need to think about our healthcare systems, about transportation systems, about our healthcare systems, about our housing systems, and about how people are getting jobs and education. And thank you again for letting me jump on that question.
Pleasure. Thank you. Tracy.
All right, we're going to end our last question here with another speed round for you all. And just would like to ask you to give some advice to our participants who are listening in tonight about how they could get more involved in advocacy, or how the best way is to communicate with you all during the special session and beyond. So if you could give one tip to everybody on the line tonight, that would be great. And Delegate Samira, we're going to start with you.
Oh, so much pressure again. One tip. Well, obviously email. Snail mail is sometimes effective, but email is the best way to get in touch. But really, I think beyond that, I think letting us know what's on your mind. I mean, sometimes, we are stuck in kind of what we campaigned on, right? We campaigned on X, and the time changes between when you campaign and when you go into functioning as an elected official. And so having that constant update about, I understand there's new issues out there, and I know you didn't campaign on it, and I know you didn't ask me for support on this issue, but it's something that I'm looking forward to, and that gives us a quicker feedback loophole so we can actually get on top of the issue a little earlier than usual. As somebody who's invested in the future of the state, myself being the youngest elected legislator in the state, I really need to hear what you think is the future of Virginia. What do you think it looks like, and how I can help with that? Thank you.
Thank you, Delegate Samira. Senator Boysko?
Sure. So the question was, how can people interact with us and let us know what they want? Is that right? Mm-hmm. So I was scrolling through the questions, and Eileen Curtis mentioned personal stories really matter. And I want to say, absolutely. Having the ability to share how you were affected with a piece of public policy can be so powerful when we are testifying, and can provide that background for someone. It can really change a heart and mind. And coming and testifying before committees, working with us as we're creating legislation, so that if you're going to be affected by something, we understand all sides of the issue, and making sure that you know that your voice matters. Whether you are a kid, I had a group of kids who contacted me about some legislation where they wanted to have goats grazing instead of using pesticides to someone who is maybe an expert in the field. Everybody's voice matters, and giving your personal experience, I would say, is the number one thing. Those postcards that are pre-done, that everybody's is exactly the same, is less valuable, although we do keep tabs on how many we get. And making sure that you're reaching out to your specific legislators is what's the most important, and building a relationship. We are just people who live in your community, and I put my personal cell phone out everywhere. I'm always happy to meet with anybody. I don't care if we are like cats and dogs and can't stand each other on public policy. I'll still sit down and listen to what you have to say, and I will try to advocate for what I think is the best answer for our community.
Thank you so much.
Mhm.
Delegate Plum, what's your top tip?
Well, all the above, those things that have been mentioned, but let me mention one additional thing, because the question also encompassed volunteer opportunities in the community. Go to kenplum.com, please. That's my website, kenplum.com, and click on my newsletter, which comes out every week. We work hard at letting people know about volunteer opportunities in the community. And if you're looking for volunteer opportunities, you subscribe to my newsletter for a couple of weeks and you'll find numerous opportunities. But furthermore, if you have the need for volunteers in the kind of work that you're doing in the community, let me know what those are so we can also help publicize them. That goes out to several thousand people. We get good comments from people who are using it as a source. It's kenplum.com, the website, and click on e-news.
Thank you, Ken. And Senator Howell, what's your top advocacy tip?
Well, I think Senator Boysko really kind of captured my main one. Tell me how what we're doing affects you and your family and your business. And don't bother sending me blast emails. I don't read them and I don't respond to them. I give them as much attention as the person who sent it did, frankly, which just it. But if you send me an email talking about your experience, how what we're doing affects you, I will not only read it, but I will personally respond to it.
Thank you so much. Those are all really valuable tips. We appreciate you very much. And Cheryl, turning it back to you.
First, I want to say thank you to all of our elected officials for being open and honest about some of the most important challenges facing our community. The questions that don't always get the time and attention they deserve, but the time is now. And so I'm going to turn it over to Cornerstone's E.W. Marshall Washington. He's Cornerstone's Director of Community Services, for our closing comments before we adjourn. Again, thank you to all our panelists, our speakers, and to all of the participants in our forum tonight. Thank you so much.
Good evening, everyone. It's my task to summarize this evening's event. I hope you are as pleased as I am to have been a part of this very important community conversation and excited to be a part of things to come. On behalf of Cornerstones, I want to thank all of our elected officials for participating in tonight's event and for taking the time to engage with all of us, hearing our thoughts, concerns, and committing to fight for the issues that matter most. I also want to thank our moderators, Cheryl Simpkins and Tracy White, for expertly navigating this crucial, sometimes uncomfortable, yet absolutely necessary conversation. I believe I can speak for everyone involved when I say, most importantly, we would like to take the time to say a heartfelt thank you to the community. Thank you for tuning in and participating in today's virtual town hall meeting, and for what we hope will be an ongoing relationship with Cornerstones and your elected officials to make the changes needed by so many of our neighbors, friends, and family members. Many, if not all of you, know the African proverb, "It takes a village to raise a child." What I would like to add to that it takes a village to be a village, and that we all have a role to play in making the village work for everyone, not just a select few. Tonight, we heard things that were difficult to hear, challenges yet to come. However, we also heard great efforts and ideas that will hopefully move us towards solutions. It was mentioned tonight that our elected officials are continuing to fight for additional federal support in response to COVID-19, despite an austere or a strict budget, as well as supporting and advocating to improve access to mental health services. Delegate Plum mentioned prioritizing childcare and recognizing how important this is for families to be able to safely return to work, and working to make improvements related to gun control, criminal justice, and prison reform, and reimagining how policing can affect or can benefit our communities. Other ideas presented were on advocating for families to return to work and for the support of immigrant communities, especially during COVID-19. Delegate Samira mentioned working and his understanding of the complex issues related to affordable housing, including the need for zoning reform that will increase the supply and affordability of housing, and for his understanding of how important affordable health care and health insurance is for millions of Virginians. The delegates and senators also mentioned the need to really listen to one another and to bond together to ensure the seriousness of our needs are heard and prioritized above the politics of the world. The need to vote and understand that we all are in this together. Checking in on our neighbors, especially our seniors, and the role we play in educating ourselves on racism and the need for racial reconciliation. Tonight, we also heard important questions from you, the community, and your deep concerns. We heard your desire for quality and affordable education for your school and college-age children, the need for additional stimulus support to maintain the economy and to build and rebuild small businesses. Some of you expressed concerns regarding the reopening of schools and whether your children will be safe if they return to school in person. You also questioned the effectiveness of virtual learning, especially considering the growing digital divide, those with limited access to working computer equipment and internet services. Others expressed the need for better access to healthcare, including mental health services, especially in these precarious times when the Commonwealth is dealing with a deadly and costly pandemic that is disproportionately affecting immigrant, Latinx, African American, and other communities of color. While we know that health, educational, and economic inequalities existed before the pandemic, we are concerned that the impact of COVID-19 will only widen these disparities, and there will be no long-term plans in place to fix them. As the Director of Community Services with Cornerstones, I can tell you that our agency and team of frontline workers see every day the struggles of the many people who are homeless or experiencing some form of housing insecurity because of the lack of affordable housing in our area. Hardworking families who struggle to keep up with the rising cost of rental housing prior to the pandemic are now on the verge of eviction and homelessness. We see the resilient families who are doing everything they can to achieve the American dream and provide a better life for their children. Yet despite working 2 and 3 jobs, they experience food shortages and at times are unable to navigate minor life emergencies simply because they are not afforded a living wage from any of their jobs. Many of the families we work with have had to overcome life challenges which would negatively impact any of us. These families make every effort to hold their families together, pay bills on time, and give back to the community when able. However, at times they need support to continue to be resilient, and we need services and policies in place that offer assistance to families when they need a helping hand. As mentioned earlier, faith-based organizations and community-based organizations are essential to this part of our community. At this time, when Virginia, along with the rest of the country, stands at the crossroads of evolution, we know that many of you want to move forward toward racial, social, and economic justice, leaving the ideas, thoughts, and beliefs that have preserved discriminatory and/or racist policies and practices in the past. We know that many of you are ready to have equitable playing fields that allow all of us an opportunity to reach our full potential, regardless of nationality, race, ethnicity, or historical practices. Once again, I want to thank our panelists for demonstrating that humanity is still an essential part of politics and governance. Thank you for the work that you do in Richmond and here at home in supporting our community, and for your honest answers tonight about the good work that has been done for Virginians during the pandemic, as well as the challenges we will face with the budget deficit in front of us. I want to remind the community of the ideas that the elected officials shared with us in terms of how we can mitigate the effects of COVID-19 ourselves. They reminded us that hunger is one of the major side effects of the pandemic, but something everyone in our community can do something about by giving to your local food banks. And remembering that people are isolated, so please check in on your neighbors, again, especially your seniors, and be kind to one another. Wear a mask and practice social distancing for yourself and for others. Remember to vote and send personal, real-life emails to your elected officials. They want to hear from you, but they want to hear from you personally. And again, I want to thank all of you community members for being a part of our village and for being willing to stand when too many choose to sit, and for speaking when far too many choose to be silent. If these issues that we've discussed tonight are important to you, stable housing, strong families, and opportunity for all, this is the time we call on you to get involved. Let your lawmakers know. Bring the political pressure to the needs that you see, particularly for those who don't always have a voice. Commit to building a community of opportunity for all, our neighbors, by getting involved in the work of racial reconciliation. And finally, please be on the lookout for follow-up information. We will be in touch with you soon regarding opportunities to support and join with Cornerstones as we advocate and work hard for these needed changes. Thank you and have a blessed evening.
When Cornerstones was established in 1970, its founders recognized that even in a community where people are welcomed and are welcoming, regardless of race, ethnicity, religion, or socioeconomic background, people could work hard and still not earn enough to support their families, that there would always be hungry people or people in crisis. Many in our community are just one unexpected life event away from living in their car or on a friend's couch or on the street. No one plans on being homeless.
My life before, I was the owner of a big pharmacy in Washington, D.C. In August of 2010, I discovered an embezzlement of several $million. And by the summer of 2014, I have lost everything. The house and my business. We have yet to leave the house in Great Falls. And in October 4th of 2014, we entered the Embry Riker Center. My first impression was a surprise. It was a pleasant surprise. The people were very, very nice. I got a nice welcome. And we got a nice room. And my biggest surprise was the food. There was a kitchen with 4 ladies cooking fresh food 3 times a day. And my biggest pleasant surprise was my case manager. He provided a lot of love and psychological support, and he explained to me all the services that Cornerstone is providing for the homeless people.
Our comprehensive programs provide stability to people in times of crisis, resources that promote empowerment for moving forward, and hope for the future. At Cornerstones, we meet people wherever they are, without judgment.
Now I have my home. My daughter, she's in school. She's very good. She's gonna go university. My husband, good job working. Now I'm thinking to go to university to finish my university and to find good job after that.
Providing stability is only the first step. Where Cornerstones is different from other organizations is in providing the gift of time and resources that continue after the immediate crisis has passed. Cornerstones empowers people to take the next step in what is often a longer journey to well-being through their own hard work and the tenacious support of Cornerstone staff, volunteers, and partners. And we see the difference that makes every day.
I become a citizen and I enjoy the class, and it's helped me also. My English is become better and I speak better now, and I understand also people when they talking. And after that I interested and I help her in the class. When I become citizen, I still come every week and help in the class.
When we got the place, the Cornerstone has been extremely supportive to us. They furnished the house because I didn't have anything left. New beds, tons of food, and any supply you can imagine. My case manager came here, brought cleaning things, sheets and clothes and food. So the ladies came here, they fixed everything for us, so it was an easy and very pleasant transition from the shelter to this place. And I'm very appreciative.
These individuals can imagine a future they thought out of reach and can begin to make goals for a better future. Goals we all share for ourselves and for our children. Goals that are possible with the support and partnership that you provide.
Immediately when we moved to the community, we knew that Cornerstones was going to be an excellent partner and build a strong relationship with us. We've been very involved with the organization, whether it's volunteering at the Embry-Rucker shelter, participating in the Help to Homeless walks, and just frankly helping to secure affordable housing for those individuals living in our community. It's such a critical need to build a better Reston.
Cornerstones is proud of the role we play as a participant, convener, interconnector, and advocate, bringing people and sectors together to solve some of our region's most challenging problems. Our readiness program for job seekers has been adopted countywide, and with our business leaders, we're defining the skill sets needed for our current and future workforce. With Reston's Opportunity Neighborhood Initiative, Cornerstones is working along with our partners to see that all children thrive in a healthy start in life and are prepared to excel in school and career. And true to Cornerstone's founders, we believe that our job is to end homelessness, not just manage it, by developing housing that is affordable for people over their entire lifetime. Together with our partners, we have reduced homelessness in Fairfax County by 47%. We remain firmly rooted in the Reston community goals handed down by its founder. We apply the value that all may live, work, play, and serve in the many areas which Cornerstones operates today.
Cornerstone, it's a very, very important organization. Based on my experience, is providing a tremendous help to needy people. And I cannot express in words how appreciative I am for what Cornerstone has provided for me and my son. And most of all is, besides again all the material things we get, is the love and the attention we get from the case management.
It's like I'm become like, now I'm doing things, I'm happy, yeah.
Reston Opportunity Neighborhood and the Neighborhood Ambassador Program is just one example of a number of supportive programs and resources that Cornerstones provides to families and individuals on their journey to a better life. Participation provides ways for residents in low-income neighborhoods to help lift up their voice and identify and prioritize their needs. These are the very same neighborhoods in which Cornerstones works to implement interventions and provide supportive care. Neighborhood ambassadors are active change leaders, problem solvers, and advocates for the change they and their neighbors want to see. Neighborhood ambassadors, resident leaders from the 5 opportunity neighborhoods, are integral partners participating at every level of leadership in our opportunity neighborhood structure in order to identify and address social and racial inequities in our community. Saizana is a dedicated volunteer and passionate advocate for her community. She saw a need among the women in her neighborhood who might benefit from greater independence and inclusion into the larger community. So she began leading a free weekly English class at the Southgate Community Center.
Having the language is a good start to being anywhere, I think. It's a confidence building. Just to be able to say hi and bye in the language of amongst the community that you live in, I think is crucial. When the kids come home from school, maybe they'll bring pieces of homework they may not understand, but at least they know, I too am learning like you. And it's a continuous journey for everybody in different scale. A lot of the women in the class have gone on to continue their education. Many are taking the GED night classes, and continuing English classes at the community college. I'm very proud of that. Many of them, some of them have come in with learner's permit when they started the class, but they've now taken that extra step of getting their driver's license, which is a huge deal. It's just a stepping stone to say, what else and what's next. It'd be wonderful, I think, if the community, individuals, families, the community together have the trust in themselves, that they have all they need to succeed. And that when they have that confidence to say, I know what I want, me, the neighborhood ambassador, the PCAs, the program coordinator, advocates, really the resource providers, we can say, we're here, we want for you what you want for yourself, and tell us how we can walk with you. And how the community can help each other, really just the encouragement.
With your help, Cornerstones can bring people together to harness the strategies, program expertise, and resources for those in need to provide greater community well-being for everyone.